I specifically trained in complex head and neck cancer and reconstruction. So that means taking care of people with problems such as tumors and cancers above their collarbone up to their skull base. And then also about 50 to 60% of my job is reconstruction. So reconstruction after someone may have a cancer or a trauma or a specific injury. I think what sets us and myself apart is that this is a very high volume center. This is something that we do several times a week, and thankfully we have great success here, and we're really able to tailor our types of cancer treatment or reconstruction specifically to the patient, because this is something that's pretty commonplace for us. Most of our patients come from a pretty far place away in North Carolina, and so they travel many hours. And specifically, I try to get to know them and who comes with them to their visit. Specifically, I like to, what they do for a living, because that does factor into how we'll take care of them and if they need any type of care during and after their cancer treatment. And specifically, in this day and age, a lot of it's about personalized medicine. Not only that, but it's a big group of us here, and so we really try to take care of the patients through a multidisciplinary approach. So collaborating with my partners and members throughout the divisions, throughout the hospital. And so I think that's what sets us apart. Something that I've always been interested in since I was really young. I thought about doing medicine or potentially doing architecture, and I wanted to go into a field where there was a lot of complex issues and where there could also be a lot of improvements that could still be made. And I felt like medicine was a place to where you can really help people, but also work with your hands and make great improvements throughout humanity and whatnot. UNC is a very storied department, specifically with respect to otolaryngology, head and neck surgery. A lot of the contemporary treatments, clinical trials have taken place here over the years. Also, it's a very robust cancer center. We're one of the highest volume cancer centers, specifically in the region, and also the country. And it's an environment to where it's a very collaborative environment with the university from a research perspective. And also part of it is I love my job is teaching residents and medical students, and I take great pride in that. And so I was able to find all of that when I came here. My favorite thing I've ever done in my life is I worked for NASA. When I was in college, I took time off to work for NASA at the Jet Propulsion Laboratory. And we specifically were looking at life on other planets such as Mars, and it was a fun time that I had throughout college, and I always look back onto it as just kind of a wonderful opportunity outside of medicine that I'm always grateful for. I have a wife and a 2-year-old. He's crazy, but I love him, and so we love to go hiking, biking, and I'm a big Chicago Cubs fan, so I like to follow them. Specifically, I take patient care very seriously, and I'm very honored to take care of our patients. As a person in academic medicine, we always talk about patient care, research, and teaching, and I think of that, patient care should always be the front and center. And I try to impart that upon the trainees that work with us and also the patients and their families, that at the end of the day, no matter whether they're getting surgery, radiation, or a different treatment for their cancers, that we always try to put their needs above anything else.